Wait, we're doing this once. I'm not gonna do
I
this
know.
second.
Okay. Hi, Mr. Clinton Olivia. What's your name?
John.
Hi, John. Today we're going to be doing some orthopedic examinations. Do I have, if you experience any pain, please let me know. Everything we discuss will be held in strict confidence. If you have any questions, please let me know.
Okay.
May I begin? Okay. So first, I will now demonstrate tests for the spinal cord and meninges. Okay, so first I'm going to start with Hermite sign. I'm going to have you lay down this way. Okay, I'm just going to flex your neck. Okay. Okay. Positive for Hermite sign is electric shock-like sensation down the spine and or through the extremities, indicating dural irritations or spinal cord injury, spinal cord inflammation or compression due to degeneration and canal stenosis. Next, I will perform Koenig's sign. Okay. I'm just going to be bending your legs. Okay. Positive for Koenig's sign is the inability to fully extend the leg and or pain, usually in the neck region, indicating meningeal irritation or meningitis. Next, I'm going to perform Brudzinski's sign. Same thing, I'm going to be just bending or flexing your neck, okay? Okay, positive would be if his knees flexed while I was doing that. So involuntary knee flexion indicating meningeal irritation or nerve root lesion. Okay, next I'm going to do Soto Halls while you're laying down. Okay, same thing, I'm going to be flexing your neck, placing my hand on your breastplate, and then pressing down. Okay. Okay. Positive for Soto Halls is generalized pain in the cervical region, which may extend down to the level of T2, indicating non-specific tests for structural integrity of the cervical spine or cervical region. I'm going to have you sit up and face the camera. We're going to do Valsalva's maneuver. So for this test, I want you to take a deep breath in and bear down as if you're taking a difficult bowel movement. Okay, great, you can relax. Positive is radiating pain from the side of the lesion, indicating nerve root entrapment by a disc lesion. Okay, and those two tests, Soto Hall and Valsalva, I was demonstrating the structure of the demonstrating tests for the structure of the cervical spine. Next, I will now demonstrate tests for the foraminal encroachment, starting with the cervical foraminal compression test. Okay, so first I'm just going to be applying pressure to your head, okay? So straight. Okay, and then turn your head to the left. And to the right. Definitely hard without a table, but okay. And the positive for foraminal or cervical-foraminal compression is exacerbation of localized cervical pain, indicating foraminal encroachment of the or facet pathology without nerve root compression. Second is exacerbation of cervical pain with a radicular component, indicating foraminal encroachment or facet pathology with nerve root compression. Next, I'm going to do the Jackson compressions. So for this test, it's similar to the last one. I'm just going to laterally flex your head a little bit. Other side. Okay, and positive, same thing as the last. Exacerbation of localized cervical pain indicates foraminal encroachment or facet pathology without nerve root compression. Second is exacerbation of cervical pain with a radicular component, indicating foraminal encroachment or facet pathology with nerve root compression. Next, we're going to do maximally cervical compression. Okay, so I'm going to rotate, laterally flex, and extend your head. Any pain? Okay, other side. Good. Any pain?
No.
Okay.
You gotta push down.
No, you don't. Not in the video, it doesn't. Okay, I'll do it. So laterally flex, extend. Okay. Extend. Yep. Compress. Okay. Positive for maximal cervical compression indicates, or positive is pain on the concave side, indicating foraminal encroachment with or without nerve root compression. The last one I'm going to do here, or second to last, is cervical distraction. So this is going to be a little bit hard, but okay, I'm just going to do one side. Positive for cervical distraction. There are three. The first is diminished or an absence of local cervical pain indicating foraminal encroachment with nerve root compression. Second is diminished or absence of radiating pain indicating, the first one was foraminal encroachment without nerve root compression. The second is diminished or absence of radiating pain indicates foraminal encroachment with nerve root compression. The third is an increase of cervical pain indicating ligamentous, muscular strain or ligamentous strain, facet or myospasm or facet capsulitis. Okay, next I will demonstrate the Cody sign. Can I have you place the palm of your hand on the top of your head? Okay, any pain? Okay, and positive for Bacodes would be a decrease or an absence of radiating pain indicating cervical foraminal encroachment or nerve root entrapment. Okay, I will now demonstrate tests for thoracic outlet syndrome, starting with Adson's, aka anterior scaling maneuver. So for this test, I'm going to start by finding your radial pulse. You can keep facing that way, please. Thank you. Start by finding your radial pulse. I'm just going to bring up your arm. Okay. And can I have you look over your shoulder towards me and take your, look up, please. Look up. And then look over your shoulder. Take a deep breath in and hold. Okay. You can relax. And if it isn't positive, if the patient doesn't have positive on one side, you would go to the next side. Positive is pain and or paresthesia, decrease or absence pulse, amplitude, or pallor, indicating compression of the neurovascular bundle by the scalenus anticus or cervical rib. Second, I'm going to perform Eden's test, aka costoclavicular maneuver. So for this one, same thing. I'm going to palpate through your radial pulse. Okay. And then next, I want you to bring your shoulders back and look down and take a deep breath in and hold. Okay. And relax. Thank you. Positive for Eden's test is pain or paresthesia, decreased or absent pulse, amplitude, or pallor, indicating compression of the neurovascular bundle between the clavicle and the first rib. Third, I'm going to do the Wright's test, aka hyperabduction maneuver. So same thing, I'm going to establish his radial pulse. I'm going to bring his arm into hyperextension. I'm going to do it one more time. Okay. And the positive for Wright's test is pain or paresthesia, decrease or an absence of pulse, amplitude, or pallor, indicating compression of the axillary artery by pectoralis minor or choroid process, or thoracic outlet syndrome. Okay, I will now demonstrate tests of the ulnar nerve. Like in my last video, I do not have a reflex hammer, but this is my reflex hammer. Okay, feels like this. May I begin? Okay, awesome. I'm gonna start by doing your elbow first. Okay. Positive for Tinel's elbow, pain or tenderness at the site being tapped, and paresthesia in the ulnar nerve distribution area, indicating neuroma of the ulnar nerve. Next, I'm going to do Froment paper sign. I have a piece of paper here. Okay, I'm going to have you open this hand. Thank you. And I'm going to have you hold as I pull this out. Okay, awesome. Next space. Okay, and last space. Awesome. You can relax. Positive for Froment paper sign. The patient is seen to flex the thumb, thereby recruiting the median nerve to compensate for apparent weakness, indicating ulnar paralysis due to weakness of the ulnar nerve innervated muscle. I will now demonstrate tests for the median nerve entrapment. First, we're going to start with Phelan's test. So for this is reverse prayer. So I'm going to have you like this for 60 seconds. 58, 59, 60. You can relax. Positive would be the reproduction of pain and or paresthesia in the median nerve distribution area, indicating median neuritis, carpal tunnel syndrome. Next, we're going to do prayer sign. So same thing like this. 59, 58, or 58, 59, 60. You can relax. Reproduction of pain and or paresthesia in the median nerve distribution area, indicating median neuritis or carpal tunnel syndrome. Next, we're going to be Tinel's wrist sign. Same thing, don't have my hammer. This is my reflex hammer. It feels like this. May I begin? Can I have you go like this? Okay, and relax. Okay. Positive for Tinel's wrist is reproduction of pain, tenderness, and or paresthesia in the median nerve distribution area, indicating median neuritis or carpal tunnel syndrome. I will now demonstrate tests for the thoracic spine. Starting with Adam's sign, I want you to stand up, please, for me. Okay. Have you turn this way. And then go ahead and bend at your waist, please. Okay, you can relax. Positive, first, scoliosis is observed to straighten, indicating, or a negative indication is evidence of functional scoliosis, trauma, or subluxation. And second, if scoliosis does not straighten, so this is positive, indicating evidence of a structural scoliosis. Next, I'm going to be performing Beaver's sign. So for this one, I'm going to have you lay down, please. Okay? And I'd like you to do a partial sit-up. Okay, awesome, and relax. Positive for Beaver's sign is superior or inferior movement of the umbilicus, indicating superior movement of the umbilicus is indicative of a spinal cord lesion at the level of T11 through T12 or the lower abdominal weakness. Inferior movement of the umbilicus is indicative of nerve root involvement T7 through T10. And last but not least is Sheppelman's sign. Okay? So this one, I want you to take your hands up over your head. Yep, and bend on both sides. He knows these, obviously. Okay. And positive for Sheppelman's sign is pain on the concave or convex side, indicating intercostal neuritis, while pain on the convex side indicates fibrous inflammation of pleura. Okay, so for Sheppelman's sign, I'll have you place your hands up here. I'm just making sure that you guys know I know it. Okay, all done.